And on presentation, he had also urinary retention. Based on the history that I got over the phone, I said the patient with this scenario it's best to get a suprapubic tube placement for his urinary retention, as it might not be possible to do a urethral dilation. So the patient came in, got the suprapubic tube, and then we scheduled him for cystoscopy and urethral dilation. In the operating room, I noticed that this is impossible task to do a dilation because of how dense this scar tissue presumably was. I had seen a picture similar to this in a patient that I took care of about 2 years ago, and that turned out to be a squamous cell carcinoma that was metastatic. So automatically I thought that this could be a bad thing, and at that point I know that the dilation was not possible, and I did a biopsy. Biopsy showed invasive squamous cell carcinoma. Then treatment of choice for this patient at that point would have been a total penectomy. However, these patients are at high risk for becoming suicidal. So at that point, I had to wait until we get a psych evaluation and clearance, which took about, who knows, a week or 10 days, and we finally got it. We did his penectomy, and again, this was squamous cell carcinoma. Our margins were clear. However, patient also had positive lymph nodes. Then he had a shoddy lymph node in the right groin, which was possibly metastatic, possibly could be infectious and inflammatory in nature. So at this point, the patient was placed on antibiotics, and he was advised to also get some insurance because we knew that he was going to need more treatments in the future. It took him, unfortunately, a few weeks before he got this insurance taken care of, and by then we also noticed that his right groin lesion is increasing in size, consistent with a metastatic lesion. At this point, I also spoke with Dr. Charles Matlin of general surgery, as sometimes these could involve vascular structures in that area. These patients can actually exsanguinate from their involvement of the vasculature, so I got him involved, and then in the next 3 weeks he got scheduled for the procedure, went for his resection. By then he comes and he says he actually has infrapubic pain. During surgery, it was noted that there was a tumor that was now growing into his pubic bone, which was debrided as much as possible. At this point, he's going to require radiation therapy for initially local control and pain control, then chemotherapy for any distant metastases.